Welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie. After learning a ton about kidney stones and helping people prevent stones at the University of Chicago, I was fed up with all the terrible advice people were finding online. So I decided to do something about it. The Kidney Dietitian was born. This podcast is for people who want to learn what actually works to prevent kidney stones and still enjoy life, eating, and their favorite foods. Let's dive in. Hello, and welcome to the 22nd episode of the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie Betts, and I am here as always to talk all about things, food, nutrition, and kidney stone prevention. And I'm really excited about today's episode, Can I Enjoy an Adult Beverage? As a wine lover myself, I figured this would be a really great topic to tackle, especially around the holidays coming up. I have to imagine that there's a lot more adult beverages flowing. And so I thought this might be a question that was on a lot of our minds. And so I wanted to really dig into it. So I hope that this is a helpful episode for you today. So we're going to dive into all the nitty-gritty things, alcohol and kidney stones throughout this episode today. But I wanted to kind of just start with some facts. There's two really large studies that have looked into the different types of beverages that, and if they are associated or not associated with kidney stones. Unfortunately, they are a bit on the older side, but these are the two big studies that tend to still be cited the most frequently when we talk about what beverages are okay, quote, or not okay for stone formers to have. And they're two studies back from both 1998 and 1996. And I know that is a bit old, but they, like I said, they're huge studies. And unfortunately, there's just not a lot of research going on in stones right now. There is, like, not saying that there's none, but there's just a very, very small group of researchers when it comes to kidney stone research compared to a lot of other conditions. And so we have to rely on some older data, but that's okay. It doesn't mean that it's not correct. So I just wanted to kind of give that disclaimer before I dive into some of the specifics of these two research studies. So the first study I'm going to mention is one that was published in 1998 by Dr. Curhan and others. And the title of the paper is Beverage Use and Risk of Kidney Stones in Women. Both of these studies are huge prospective cohort studies. So basically we look at this huge group of people, we follow them for a long time, and do they form kidney stones? And we get some data along the way in terms of what they're eating and drinking in this case. So this particular paper that was published in 1998 looked at about 81,000 women, and this is all data from the Nurses' Health Study. That's a really, really big cohort that we tend to get a lot of nutrition data from. And they found that women who drank wine had a 59% reduced risk of kidney stones, which is pretty great. So a lower risk of kidney stones in women who drank wine. This study found that there was actually no association with beer or liquor. So drinking beer or liquor didn't have the benefit that wine seemed to have, but didn't also seem to harm them necessarily when it came to stone prevention. The second study that we tend to cite a lot was one published in 1996 by the same main author, Dr. Gary Curhan, and this paper is titled Prospective Study of Beverage Use and the Risk of Kidney Stones, and this again is this huge prospective cohort study. So this one looked at about 45,000 men, and this is data from another large cohort that we tend to use for epidemiology called the Health Professionals Cohort Study. And this study found that men who consumed beer had a 21% reduced risk of stones. People who consumed wine had a 39% reduced risk of stones, and there was no association with liquor. So to kind of put that all together, it seems that wine in both of these big studies that we tend to cite most often was associated with a lower risk of kidney stones. Beer was associated with a low risk, but only in the second study, which was looking at men as opposed to women. And liquor in both of these studies did not have any good or bad effect when it came to stone prevention. So this is really great news for those of us that enjoy an adult beverage from time to time. It seems that just having a kidney stone certainly is no reason that you need to avoid alcohol altogether. So of course I have a couple caveats to that statement, and I wanted to also dive into how could this happen, like from a physiological standpoint, how is drinking alcohol associated with a lower risk of stones? And I've got two big thoughts here. So the first one, I think, is that it's simply fluid. As we talk about all the time, just drinking liquids, most fluids are associated with a lower risk of kidney stones, and alcohol is no exception. More fluid you drink, the more diluted your urine is going to be, and the less likely you are to form stones. And so I think there's definitely something to be said for just simply drinking liquids. FYI, the only liquids and fluids that tend to be associated with a higher risk of stones are those liquids that include sugar. And so when we look at things like regular soda or sweet tea or sugary energy drinks and those types of things, those fluids are associated with a higher risk of stones, but all other fluids, alcohol included, also including tea, for the record, are all associated with a lower risk of stones. And so I think there's definitely something to be said by the fact that this is just simply a fluid that's diluting your urine, and so it's doing you good. The other thing that alcohol specifically does is it is a diuretic. It has a slight diuresis effect. We all know if you've, been out and you're enjoying some drinks, you tend to go to the bathroom a lot more than if you were just having water all the time. And so this diuretic effect, this diuresis that is caused by the alcohol actually reduces the concentration of your urine, perhaps a bit more than even just having straight water would. And so there might be something to be said for this diuresis effect that we're getting with alcohol. However, the effect size that we're seeing in these studies is not ginormous, and this data does not make me say that everyone with stones should be drinking alcohol. If you do not currently consume alcohol, I am not saying that you should start drinking alcohol to prevent stones, but if you already enjoy alcohol from time to time, having a kidney stone or doing your best to prevent more stones is no reason that you need to stop having those alcoholic beverages. Of course, we should go with what the CDC says in terms of how much alcohol we should drink, because more is not better, especially when it comes to alcohol, of course. So technically, the CDC says that women should have no more than 1 drink per day, and men should have no more than 2 drinks per day. Because, of course, when we start drinking a lot more alcohol, there are certainly other health risks that are associated with it, specifically things like high blood pressure, heart disease, many different cancers, dementia, of course, social issues that come into play, things like lost productivity and unemployment and those types of things, depression and, all sorts of things. So, again, I'm not saying that all of us should go out and start drinking a bottle of wine a day. That would be associated with all sorts of other issues. But again, if you do enjoy alcohol, having a stone is no reason that you need to stop enjoying alcohol. Just please do it responsibly. And a lot of people will ask, like, okay, Melanie, cool, I got it. Like, I can have my wine, but what about beer? What about liquor? Is it okay to have liquor? What about oxalate in beer? So I kind of put together a list of the questions that I get most often when it comes to alcohol and kidney stones to hopefully knock them all out in this podcast. So honestly, my advice as to what kind of alcohol is best is just to choose what you like, right? This is an alcoholic beverage. This is meant to be a treat. If you are drinking so much alcohol that any of the things I'm about to say really make a huge difference, then we probably have other issues that I'm more concerned about. This is meant to be something that you enjoy. So I would say just go ahead and enjoy what you like and just drink it in moderation per what the CDC recommends for us with that 1 to 2 drinks per day. But I do have a couple tips for, things to keep in mind when you are choosing your alcohol. The one thing I will say about beer is that beer, especially dark beers, do have a fair amount of purine in them. And beer and alcohol in general, but especially beer, can make gout worse, and also uric acid kidney stones, perhaps worse from this gout purine perspective. And so if you do have uric acid stones or do have gout, because I know many of my listeners do, I would say maybe choosing a different alcohol than beer might be the best option. But again, if you're having 1 beer once in a while, it's not going to be a big deal. Just please enjoy it and move on with your life. But if this is something that you're having more often, it might make sense to choose an alcohol other than beer. Another question that comes up quite a bit is how much oxalate is in beer, because apparently there's lists out there that list beer as like the worst thing in the world when it comes to oxalate. First of all, this is simply not true. The oxalate content in beer varies widely, as it does in all things, depending on the type of beer that you're drinking, even apparently if it is from the fountain or a can, or not fountain, the draft, the draft beer or a can. But even on the high end, a 12-ounce beer only has around 6 milligrams of oxalate. So like, guys, that is not that much. It really doesn't matter. Again, if you are drinking so much beer that the oxalate content is a concern, that is a huge concern. And we're not talking about oxalate. We're talking about other things. So I really, really wouldn't stress about the oxalate in beer. And as always, whenever I talk about oxalate, I beg you to not just blindly start following a low oxalate diet. Please get that 24-hour urine test to make sure that your urine oxalate is high even when you're getting in enough calcium, because if we go down this low oxalate route, it's incredibly stressful, and it's so difficult to know how much oxalate, virtually impossible to know how much oxalate you're consuming. And so many people, even with calcium oxalate stones, do not need to be on a very low oxalate diet. We really just need to work on getting the net calcium, get that urine oxalate down to normal levels, and you'll be fine. So I know I say that 1,000 times, over and over and over again, but it's so important. So I always like to give that caveat whenever I talk about oxalate at all. And then the last comment I wanted to make when it comes to alcohol is sugar, because of course there is a huge difference in how much sugar is in your adult beverage depending on what you're choosing. And as I mentioned earlier, sugary drinks are definitely associated with a higher risk of stones. Again, this is meant to be a treat, and so if you love a margarita or you love a sex on the beach or whatever it is, like, that is cool. Like, please just enjoy it. And again, move on with your life. But if this is something you're having often and you would prefer to use your sugar budget for something like cookies, which would be my preference, or ice cream, if I'm being honest, ice cream is my all-time favorite dessert, then you might want to consider how much sugar is in your drink, because there can be quite a bit of sugar in different alcoholic drinks. So your lower sugar options are going to be things like wine, a dry red or white wine. On the higher end, things like, again, those cocktails and those types of things are going to have a lot more sugar. Also thinking about the mixer that you're using. So if you're using like a rum and Coke, that Coke is obviously going to be adding a lot of sugar to your drink. Even juice. So, my thoughts on juice are sort of neutral to negative. Like, I don't love juice, even 100% juice. I know it doesn't have added sugar, but I would just much, much, much prefer you get your fruit from actually eating fruit, because then you're going to get the wonderful fiber and, just kind of a lower sugar load, if you will, than if you're drinking juice. Not saying that you can't have juice, of course, but I prefer you eat your fruit if possible. But point is, juice often is used in mixers, and that's also going to be adding sugar to your drink. So something also to consider. So hopefully all of that information is helpful and you can feel more comfortable enjoying your favorite alcoholic drink with your friends and family this holiday season. I wanted to kind of put all of my recommendations wrapped with a bow for you at the very end, because I know I kind of was all over the place in this episode. But the bottom line is that alcohol is generally associated with a lower risk of stones, especially wine. But that is no reason that we need to start drinking to prevent kidney stones. If you do already consume alcohol, that is fine. Try to keep it to no more than 1 to 2 drinks per day as recommended by the CDC, and you don't need to stop drinking just because you have kidney stones. And of course, we need to weigh the pros and cons when it comes to consuming alcohol, because we know that alcohol is a drug and it's not benign, that excess alcohol, especially drinking more than 1 to 2 drinks per day, is associated with things like hypertension, heart disease, cancers, and dementia. So all these important things to consider. But again, I hope that helps you feel more comfortable enjoying, for me, my glass of wine, most likely a Pinot Noir from Willamette, which is my all-time favorite wine. So if this is interesting to you and you want to dive into this a little bit more, definitely check out a blog post on my website, which I'll link in the show notes, where I kind of dive into everything that we talked about in this podcast a little bit more in written format. I know all of us like to learn in different ways, so I do have a pretty robust blog about alcohol and kidney stones on my website. In the show notes, I'll also link to those 2 big studies that I mentioned. And I also wanted to mention that I'm having a free class coming up on January 18th at noon Eastern time. It's going to be titled Help, I Have a Kidney Stone, Now What? Again, this is a free class, so I'd love to see you there. Get it on your calendar early. I know it's about a month away, but life gets crazy around December and the new year, and it will be January 18th before we know it, which is crazy, in 2024. So if you go to kidneystoneclass.com, you can register for that free class. Again, that's coming up on January 18th at noon Eastern. Definitely, even if you can't make it live, register anyway, and then I'll definitely be sure to send you a recording of the class. These classes, I've been trying to do them every couple months, have been really well received. It's been so fun to meet so many of you. Usually there's hundreds of people on the class, and it's just so much fun to actually meet you sort of in real life and connect with you on a more personal level. So again, head to kidneystoneclass.com to register for that free class coming up in January. And with that, I will close this episode of the Eat Away Kidney Stones podcast. I hope to see you next time. Thank you for listening to today's episode. For more help with kidney stones, check out my website, www.thekidneydietitian.org. For more personalized help from me, check out my online course, Kidney Stone Nutrition School. VIP enrollment includes help directly from me. I can't wait to see you there and help you prevent kidney stones. Have a great day.